viewers, welcome back to this channel. My name is Debbie Kiboma.
My name is Benta Kerubo.
This is DR.BHARATH VYAS.
Thank you so much and thank you for clicking this video. So today guys, we are going to talk about insulin analogues, and we have Dr. Bharath here, our cardiodiabetologist, who is going to take us along.
Yes, thank you for introducing me. Insulin analogues are the new types of insulin. Okay.
Yes.
When first insulin was discovered by Banting and Best, Canadian physicians, way back in 1950s, at that time the insulin was made mainly from animal sources, and that is especially pigs and cows. Okay. Later came the recombinant DNA technology, using the gene splicing methods, that is manipulating the genes of a bacteria by name Escherichia coli.
Yes.
We started producing insulin, which is human insulin. Human insulin in the sense, the previous insulins were animal insulins, and they used to cause hypersensitivity reactions, that is allergic reactions, because the source is not human in nature. After recombinant DNA technology, we started producing insulin using the E. coli bacteria, and the insulin produced by this E. coli bacteria is exactly same as human insulin. So that's why it is called human insulin, and because of that, the reactions to the insulin injection has become precipitously low. Okay.
Yes.
But then we understood more about insulin mechanisms. What happens is, in the body, the insulin is not produced in one continuous stream. Okay. There is something called basal insulin, which is produced at a constant rate, and there is postprandial insulin secretion, which achieves a peak. You can see that in the graphic that we attach with this video.
Yes.
So there is basal insulin, and after postprandial means after eating, there are spikes in insulin production. Okay, that is the normal physiology. But the problem with recombinant human insulin was that either it has to be given multiple times to mimic this. Okay.
Yes.
And the insulin had to be taken at least half an hour before eating meal, which was difficult. Okay.
Yes.
So the newer types of insulins were created. What was the reason it was created? To mimic the natural physiology of human body. Okay. And these newer types of insulins, their mechanism of action, either they are created for very long acting mechanism of action, or also for instant starting of action. Okay, onset of action is very short for the newer insulins. These newer insulins are made based on the regular insulin molecule only, but by deleting or adding more amino acids to the insulin chain. Okay, by that we manipulated the onset of action and also time of action. Okay, these insulin analogues are basically two types, or actually you can say three types also. Ultra short acting, medium acting, and very long acting. Okay, the examples for ultra short acting are Lispro, Aspart. These are some of the insulins which are available in Kenya, and their onset of action is very small. Within 3 minutes of injecting the insulin, it starts acting. Okay, so this controls the postprandial rise. That means after eating the food, the immediate rise in the sugar level is checked by these ultra short acting insulins. Okay, then there is long acting insulins. Long acting insulins are Glargine, Detamir, Glargine and Detamir. These are available in Kenya. Okay, especially Lantus is more popular because it is available everywhere, and Lantus works for 24 hours. Okay, so what we do is we give Lantus in the night. Okay, so that it works for 24 hours, and before every meal we inject the ultra short acting. The only inconvenience in that is patient has to take multiple times, but what happens is with these kind of insulins, almost 99% of the people whose sugar is not controlled, it is controlled very beautifully. So that is the reason why these newer insulins are introduced. They are also helpful in breaking the resistance. Many diabetic patients who are dependent on insulin, what happens is their diabetes has become resistant. to regular insulin formulations. So for those people, we used to give high concentration insulin previously, which is called U500. Okay, those kind of people also, they get very much helped with these newer insulins. And these newer insulins can be combined with medicines such as metformin. So which is again very good.
You mentioned about injecting yourself the insulin. What if I miss injecting myself?
Yeah, it can happen once in a while. Even I miss my diabetic medicines. Of course, I am not on insulin, but many people do miss medicines once in a while. It's very easy. Actually, when in our hospital, what we do is we give a chart. Like for this much of glucose, this many units of insulin you have to take. Okay. So what is happening is now the control of sugar, we are giving the control to the patient instead of doctor controlling. Doctor controlling the dosage is becoming more and more unpopular nowadays, because what is happening is patient cannot see the doctor every time.
Yes.
And it is not possible for a doctor also to attend the patient whenever they require. So we are giving more control to the patients.
And Doc, how often should the diabetic patients see a diabetologist?
Every 1 month at least. That is better. As long as patients, I mean, in my own personal practice, it's my personal experience. People who are in regular control, some people will even stop diabetes medicines. Diabetes can regress. Unfortunately, people don't know that. Actually, not many doctors also know. Diabetes can regress, and we did stop medicines to couple of patients because they become normal.
And Doc, you spoke about the short-term medications. Now, and one of its disadvantages, it's the many times you get to inject. Any other disadvantage to the new?
Actually, that is also not disadvantage. Nowadays, these all insulin analogs are coming in the form of pens. You don't even know that you are pricked with the insulin pens. Yeah. Only thing is that just like you take a tablet on time, you have to prick on time. But that is not prick. You will not feel any pain because the needle is very, very ultra fine. Yeah.
So are there some importance of taking this insulin? Because there is a myth that says that insulin kills.
No.
In type 2.
Insulin is the best. Actually, insulin is the best treatment. What is not there in diabetes is insulin. You are giving the same thing. Okay. Insulin is one of the best medicines for treating diabetes. But then again, insulin need not be taken lifelong. There are many patients with us also who are initially put on insulin, and when they achieve control, we take them off insulin. Insulin need not be taken lifelong. This is also a myth actually. Not many doctors also know that insulin can be taken off. There is a way of doing it.
To diabetes being a chronic disease, actually diabetes, does it kill? Is it cured or it kills?
Yeah, we did cure. Couple of days back we had a patient. She was diabetic, she was put on medicine and cured in the sense controlled very well. And if she follows the healthy lifestyle, she will not require medicine. If she doesn't follow the healthy lifestyle, she may require medicines.
Okay, thank you so much. Is there a message that you can give our viewers about insulin analogs?
Don't be afraid of taking insulins. They are one of the best medicines a doctor can offer.
Thank you so much guys for watching this video. Remember to click, like, share, subscribe, and let's meet next time with another video. Bye.
Bye.
Thank you.